So today's session is all about healthcare in Ontario, as well as UHIP, which is one of your health insurance plans. And this is a joint presentation through the International Student Experience Office, as well as Student Wellness. My name is Andrew Staples, and I am the Student Success Coach, and I'll be talking to you about the presentation for a little bit. Taylor from Student Wellness is also going to be joining to talk about the Student Wellness Center, and Yufei, who is with the School of Graduate Studies, is behind the scenes to help share some links. So before we begin, what we would like to do is what's called a land acknowledgement. So we do recognize that this might be something new if you've never been in Canada before. And so land acknowledgement is a way to recognize and acknowledge the traditional territories that McMaster University is located on. So McMaster is located on the traditional territories of the Mississauga and Haudenosaunee Nations and protected by what's called the Dish with One Spoon Wampum Agreement. And so if you can imagine the land that we are living, working, and studying on representing a dish. And the idea is we all have, a spoon that we are sharing the land, sharing the resources for those who are living here and those who are yet to come. So this is something that you will commonly see when you are in Canada at the beginning of a meeting or a workshop. As I mentioned, this is one of our webinars that's brought to you by the International Student Experience team. So again, as a reminder, we are here to support all international and exchange students now as you arrive to campus and throughout your journey at McMaster. And even once you've graduated, we can offer some support. So we have different workshops and programming. We have socials that will help you connect with other international students. There's advising appointments, immigration appointments, and we oversee UHIP, the health insurance plan, which is what we're going to talk about today. So just a little bit of housekeeping items. You are welcome to use the chat to interact with each other, socialize, comment. But if you do have any questions for us throughout the presentation, we would like you to use the Q&A feature to ask those questions. So for today, what we are going to talk about is first an overview of healthcare in Ontario, what that looks like. We're then going to talk about healthcare resources on campus through the Student Wellness Center. And then finally, we are going to talk about UHIP, the University Health Insurance Plan. We will then have time at the end for a Q&A. So to get started, we're going to talk about sort of the differences and what the norms are of healthcare in Ontario. And so there's a few things that you should be aware of. So your health is considered a very private and personal matter in Canada. And it is quite common culturally that people do not share details of their health if you are not comfortable doing so. So anything that you share in terms of your health with a doctor or a nurse or a counselor, that would be considered private information between you and the health practitioner. In Ontario, we really work on what's called the referral system. So this means, if you are used to, maybe at home, you say, I want to get a checkup and get my blood tested, and you just want to walk in and get a blood test and read the results yourself, or go see a cardiologist yourself. That is not the way the system works in Ontario. It's based on a referral system. So typically you would connect with a family doctor or a walk-in clinic or a doctor at the wellness center. And then based on that first assessment, they would refer you to a specialist. Within the system, it is really important to self-advocate for yourself. So we operate on what would be sort of like a universal healthcare plan where it is accessible to everybody. And because of that, there can often be long wait times, and it can be sometimes slower than maybe what you're used to. And so being very transparent about what you are feeling, what you are experiencing, and advocating for yourself and to get service is really important. Trying to be humble and reserved when trying to see a doctor might not get you the service as fast as if you are very open and, explaining what is going on and why you need that support. Unfortunately, there can often be long wait times at certain clinics and healthcare centers. And I'm going to talk about the different medical options shortly, but for urgent care and emergency departments, it can actually take several hours, depending on the time of day and where you go, to actually get in and see a doctor, because the way the system works is that there are or there can be significant wait times. And then for medication, so in Canada, you can go to a pharmacy and get what we would call over-the-counter medications. So that could be things like cough medicine or Tylenol or Advil, allergy medication. Those are things you can go into the pharmacy and get on your own. But if you need an antibiotic or something that the government deems to not be accessible, you would have to get a prescription from a doctor in order to access that. So we wanted to kind of set the stage of what some of the norms are, so you are aware of what to expect. And so when you are in Ontario, there are a few different types of medical services that you can access. And so I'm going to go into detail about all of these. So the first would be what's called a family doctor, or your primary doctor. So this would be a doctor who you can make an appointment with, who you would meet with, maybe, I don't want to say on a regular basis, but it would be kind of your go-to person if you have any non-emergency concerns. And they can help diagnose, minor injuries or illness. If something's going on and you want to maybe be referred to a specialist, if you need prescription medications renewed, if you need birth control, or any kind of non-emergency support, the first step would be to go to a family doctor. And so as McMaster students, it can be quite difficult to find a family doctor in Hamilton. So we do have the Student Wellness Center, which would act as your family doctor. And Taylor will talk more about that shortly. Another option would be if the Student Wellness Center is closed or you can't find a family doctor, would be to go to what's called a walk-in clinic. And so a walk-in clinic would also be to go and speak with a doctor for a non-emergency situation, but you're not able to make an appointment. And just as the name calls it, it would be a walk-in. And so depending on how busy it is, it could be a few minutes to a few hours to wait. Again, if you need service, obviously it's worth waiting. But if it's something that you can wait till the next day, call the Student Wellness Center to go see a doctor, that could be an option too, to book that appointment. And so in the chat, UFE has put a link to the walk-in clinics in Ontario, and obviously you can narrow that search to Hamilton. So the next kind of level of care would be what's called an urgent care center. And so an urgent care center would be something that is more urgent, but non-life-threatening. So this could be, if you fall and you think you have a sprain or a strain, maybe you're cut and you think you need some stitches, you've got some minor burns, or maybe you've got a sign of infection. And so this would again be for something that's non-life-threatening, would be to go to an urgent care center. There is one fairly close to campus. It's called the Maine West Urgent Care Center, but there are other urgent care centers in Hamilton. And then the final option would be if it is truly an emergency. And so anywhere in Canada, if you ever have an emergency, whether that's a medical emergency, you see a fire, or something for your personal safety, you can call 911 from any cell phone or phone booth, and that will automatically connect you with emergency services. So if you need, let's say, an ambulance to come pick you up, you could call 911 to get that. If you don't need an ambulance, but you feel it is an emergency and you need to go to a hospital, what you'd be going to would be called an emergency room. And so this would be for things if you're experiencing or you observe, loss of consciousness, you're taking some pain medication, but the pain is not going away. Anything related to your heart or chest pain, breathing difficulties, or if you're experiencing a mental health crisis, that would be a referral to, or sorry, not a referral, that would be when you would want to get to the emergency room. And so it is important to remember that emergency rooms are for life-threatening emergencies. So because there can be significant wait times, if it is 11 o'clock at night and, maybe your arm kind of hurts, but it's not severe pain, but it's not normal and you want to go get it looked out, but you think maybe you can wait till tomorrow, don't go to the emergency room, because what's going to happen is they have a triage system. And if it's not a life-threatening emergency, you might be waiting for hours and hours and hours because people with priority are going to be seen first. And so that's why really emergency rooms are only for those emergencies. So McMaster does have a hospital on campus that offers emergency room care, but it is a children's hospital. So, depending on your age, if you are, 17 years of age or younger, you could certainly go to the hospital on campus. But otherwise, which I think would be for most students, you would be going to one of the other emergency rooms on campus. So there are a couple downtown, the Hamilton General and St. Joe's, or there's Juravinsky Hospital up on the mountain. And so next I'd like to introduce Taylor, who's going to talk about some of the great services that we have available on campus.
Hi, everyone. So my name is Taylor Mertens. I'm a health promoter here at the Student Wellness Center. A health promoter is doing kind of more preventative work. And so we do a lot of I do a lot of cooking classes, so a lot of food, cooking skills, knife skills. So if anyone needs some pointers for knife skills, I'm happy to help there. We also do active living movements and helping people with kind of their fitness and physical journey for physical health. So the Student Wellness Center is a lot of things, but I think the main thing we're talking about right now is the Student Wellness Center as a clinic, and this clinic is right on campus. So you can access medical or mental wellness support here, and we are located in the Peter George Center for Living and Learning on the second floor, which is right across the David Bradley Athletic Center and Togo Salmon Hall. So once you're on campus, you'll be able to find it for sure. So when it comes to medical services, as Andrew said, we're kind of like the first step for a lot of international students and a lot of students in general. And we provide various services just like a family doctor or walk-in clinic would, including treatment of minor illness, injury, immunizations, including we run flu clinics for flu shots during the fall. And as Andrew also said, we can provide a lot of referrals if we cannot treat it ourselves as well too. So we like to think of ourselves as the first step, but of course you can also access urgent care, as Andrew mentioned. Additionally, we can also provide doctor notes, especially for non-over-the-counter pharmaceuticals like antibiotics. So definitely come check us out for that. We provide dressing changes, wound care. We also provide birth control options, including IUDs and implants. We have sexual health education, and we also have STI testing, as well as gender-affirming care. And all your medical appointments are covered under UHIP and that program. And we'll get into the booking part later as well too, in the proper intake system there. So Next, we'll talk about counseling. And counseling services are offered to all students at no additional cost. And you can speak to counselors by booking a 20-minute consultation appointment to discuss what options are available for you. So we provide one-on-one counseling, group counseling, and workshops and group programs, and a lot more. But this is like a very concise way of talking about it. So you would call and book an appointment at reception, and we'll go over the intake process later, but just a little bit more about the mental health programs we have. So we have online programs, we have workshops and groups in person that really help you build the skills to deal with common issues that students usually experience, and one-on-one counseling when needed. So it's important to explore many options, and quite frankly, it takes a lot of different factors as well too, depending on where you're at in your mental health journey or your physical health journey as well too. So it's important to explore the groups and the programming, and then as well as actually going to therapy and going to counseling as well too. So to keep up to date, because it is kind of changing based off of student needs and the season and stuff like that, make sure you follow us on Instagram as like our main point of contact, or Facebook as well too, for regular updates and education, as well as like when hours change and stuff like that, or if we're closed for a certain day as well too, just so that way you have the best information to access the Student Wellness Center when you need to access us. So a little bit about the eligibility. So all SWC services, student wellness services, are free for full-time undergraduates and full-time graduate students, provided that person is in Ontario. And all of our group programmings and workshops can be attended by all students as well too. So some students we don't see, unfortunately. This is including the MBAs, the Masters of Business Administration students, medical residents, part-time undergraduate students, unless they're registered with the Student Accessibility Service. That's accessibility and accommodation service on campus. And postdoctoral fellows and students taking courses for the continuing education program. This is because students have kind of opted out of paying for the fees towards our services. So unfortunately, based off of that, we can't service them. And to make sure that full-time undergraduate and graduate students, including international full-time undergraduate and graduate students, receive proper service as well too. So there's been questions about children and about parents in the Q&A so far about using our services. And oftentimes we hear about partners of students as well too. Unfortunately, they are unable to also use the Student Wellness Center. So children, partners, or significant others, husbands and wives, and parents are unable to use our services. As we learn to live with COVID, and we're moving more into in-person activities, the majority of our appointments are in person. However, we will still offer some virtual appointments when appropriate, through the phone or through Zoom. And this is and that's when it comes to that you have to be in Ontario to access our services, unfortunately, just due to information law about confidentiality about accessing our services. So I'm actually, if I can just quickly take a detour there as well too. Ontario has the Personal Health Information Protection Act, which the SWC is covered under, which, unless requested by the patient, all health information about a patient and the patient files cannot be accessed by the patient's legal guardian, by McMaster University, and by other kind of institutions. So although the McMaster Student Wellness Center is technically under McMaster, we have very strict information laws here that make sure that unless there's a duty to harm yourself or someone else, that a health provider does not ever give up your information, and it will no way impact your student your file here when it comes to student conduct, unless there's a threat of harm to somebody or to themselves. So I just want you guys to know that we are McMaster University, but there are laws that are protecting patients and their information. So just wanted to highlight that real quick for everyone too. So just in terms of the intake process, it's easy to make an appointment for any of our services. So call us at the 905-525 914, which is the McMaster phone number, and our extension is 27700. And the receptionist will help you. We have a great team of receptionists. They're always on the phone, always receiving calls, and trying their best to make sure that we get to you in a speedily manner. You'll be asked to fill out a patient agreement form and a UHIP claim form once a year. So the first time, kind of when you're booking it or you're coming in person, make sure you just give yourself a little bit extra time to make sure you fill out this paperwork. This paperwork can also be accessed on our website at wellness.mcmaster.ca. If you're seeing a counselor for the first time, which is this left column here, you'll also have to fill in a counseling intake form. This helps the counselor identify the best course of action for you. So that way they have time to do a little bit of research before your appointment. So you make the most of that first meeting in the intake process to make sure that you get the best care and can you don't have to start from the scratch, and that they have a little bit of information from you. So that way, let them do some like background work. So that way, once you're in that first consultation appointment, you can kind of move forward and talk about what's happening with you. Okay, so it's important to note that not all students will need to see an individual counselor, and some may benefit from learning skills and resources to maintain and improve their mental health in a group setting or in an individual workshop. This is also academic and personal. So sometimes, yes, it's about school and grades, and if you're graduate students, potentially being a teacher, but also it's also about personal lives, dealing with family, dealing with relationships, dealing with interpersonal conflicts with roommates and stuff like that. So we try to cover a lot of ground that can really impact your mental health. Okay, so next we talk about the health promotion team, which is I'm a part of, and we offer many programs and events to help your mental health, sexual health, substance use, physical activity, food literacy, and graduate wellness. So these events are managed and developed by our health promotion staff, and each year we hire a team of volunteers called peer educators, who help us to take the most up-to-date and verified health information. And we talk about it in events, campaigns, we talk about it on social media, on websites. And this year we'll be on last year we were on campus for the first time since COVID. And so we're going to continue and increase our in-person events. So that way you get to engage with other people. And I think it's really nice to talk about mental health and talk about food and talk about sexual health in a group setting as well too, because it makes us feel a little less alone, which I think is really important. So again, follow us on Instagram, follow us on the wellness.mcmaster.ca/programs is a great summary of everything that's being offered for the term. And make sure you check that out a little bit closer to August. And so that way you can see what's happening in the fall and register for certain events. And some of them will be drop-in. So that will be a little bit more casual to approach. I'm just going to highlight a few programs that we think we kind of cater to international students and we think are really important. So these programs are developed and trained by trained counselors and health promoters. So we have Meet Your Neighbor, which is a drop-in group for international students to meet other international students. This is going to be in person this year, and we're really excited about that. Zainab Kawaja is a phenomenal speaker. She was an international student herself and kind of understands a little bit about adjusting to the Canadian context as well too, as well as dealing with kind of family back home. And yeah, and also it's just like a good vibe, good way to meet new people, good way to relax as well too. And yeah, talk about kind of have a space to talk about adjusting to the international context, which I think is super important. Next, we have Black Escape, which is a student-led mental health peer support group that offers a space for Black students to have a safe and liberating discussion about mental health and healing. One of our counselors, Glenda, runs this event. She's super phenomenal. The students are so fantastic. Talk to them all the time when they're in the lounge and stuff like that. And it's a really great experience. And the programming that they do and the ideas that the students have and kind of make to life is very good. So if you're having trouble navigating kind of racial dynamics or experiencing racism as a Black student, I think this could be a very great space for you. And also if you don't experience like racism, but you just want to meet other people who are going through different experiences or have similar experiences as you, definitely check out this resource. And yeah, that's a bit about the student wellness, and I'm sure I'll be answering some questions as well too later. So thanks, guys.
Great. Thanks so much, Taylor. So next we are going to talk about UHIP. I know that there are a lot of questions in the chat, and I hope that the presentation will help answer some of these. So UHIP stands for your University Health Insurance Plan. And so I'm going to go into a bit more details about what it is, coverage, and what it isn't, as well as what your supplementary plans are. So UHIP coverage typically goes from September 1st to August 31st of any given year. But for this group, which are first year incoming international students, I suspect that's who everybody on the call is, your coverage actually will begin as of August 10th this year. So if you are arriving middle of August or end of August because you need to get settled or you wanted to come here before September, your coverage for this year will begin August 10th. With UHIP, it is something that you are automatically enrolled into every year. So you do not need to connect with us. If you to be enrolled, this would be something that would be part of your tuition fees. So the cost of UHIP is $756 for 12 months. So that would be for the September to August. But as I said, as a new student, it will actually be from August 10th until August 31st. And so the way the billing works is that you would be paying part of your fall fees at $756 for the full year coverage. So it works out to about $63 per month. So there are going to be some exceptions to this fee. So exchange students who are here on a study permit, you are also covered under UHIP. But if you're only here for 4 months or 8 months, and you are going to be leaving Canada, within that UHIP coverage time, you would not be paying for that full fee. Okay, everybody else, as a full-time international student, it would be the 756. But if you are here for a shorter period of time, it would be prorated per month based on the time that you are here. To actually receive your UHIP card, what is going to happen is in mid-September, you are going to get an email from the insurance provider. So the insurance provider's name is Cowan. I'm just going to put that name in the chat. So you would get an email in mid-September from Cowan. And in this email, it is going to give you a unique ID as well as a link to log into the Cowan portal. What you would then need to do is follow the instructions in that email, log in, and you would then have access to your UHIP insurance card. What I would recommend that everybody does is print off your UHIP card, because if you're in an emergency, the last thing you want to be doing is trying to search through your inbox and find a UHIP email that was sent maybe months ago. So what I would suggest, as soon as you get that email, just simply log in, download. It's going to be a PDF, the version of the card, print it off and stick it in your wallet so you've got it with you at all times. If in terms of doing your sort of payments, not payments, in terms of accessing services. So because you're going to be getting your card in mid-September, if you are arriving before that date or in early August and something comes up and you need you need to go to urgent care, you need to see a doctor, or something has come up and you need that coverage, what might happen is that you would need to pay upfront for that service, and then you would submit a claim afterwards, simply because you don't have that card yet. As soon as you have your UHIP card, At most service providers, what you would do is you would show your UHIP card, to the wellness center, to urgent care, to the emergency room, and then they would, so any cost associated with that visit, they would then bill your insurance company directly, so you don't have to pay anything up front. So I know there's quite a few questions in the chat about, do I have to pay for urgent care? Do I have to pay for these referrals? So anything that UHIP covers with your UHIP card, when you show it, most providers will know what UHIP is, and they will charge UHIP directly, so you don't have to pay anything up front. If you don't have UHIP, your UHIP card, or you forget it for some reason, you may have to pay up front, but then you would just submit some forms to get that cost reimbursed. So in terms of what does UHIP cover? So UHIP covers what would be equivalent to what's called OHIP, which is the Ontario Health Insurance Plan, which would be what Canadian citizens and permanent residents have in terms of our sort of universal health care. So it will cover things like if you need to go to the hospital, if you need to see a family doctor, if you have to get an X-ray, ultrasound, any lab tests, blood work, need to call an ambulance, anything like that to help you with any kind of medical issue that arises. So I'm not going to list out everything. What I would encourage that you to do is to go to uhip.ca, and you can read through the really comprehensive list of what you are covered for under UHIP. However, because UHIP mirrors OHIP, it is important to recognize that there are things that you are not going to be covered for. So things that you are not going to be covered for are any kind of prescription medication. So if you go to the doctors and they prescribe you some antibiotics, the doctor's visit would be covered under UHIP, but the actual medication would not be covered under UHIP. If you need physiotherapy or massage therapy, or vision test or eyeglasses, that is something that would also not be covered under UHIP. If you have a cavity or need to go see a dentist, that is also not going to be covered under UHIP. Okay, so UHIP is going to cover a lot of your medical needs, but there are certain things that are not covered under UHIP. And so that's why, as an international student, you will also have a supplementary plan that is also part of your tuition. So that is going to be the MSU Health and Dental Plan, which is for undergraduate students, or the GSA Health and Dental Plan if you're a graduate and MBA students. If you are a visiting graduate student, you can opt into the GSA plan. If you're an exchange student, you are not eligible for either of these plans. Okay, so if you're an exchange student, anything like prescription medication, dental, massage therapy, you might, you could try to see if there's any travel insurance, if that's something you're looking to get covered under, because that you would not be part of the MSU Health and Dental Plan. So the things that I've listed on screen here, dental, massage, all of this is going to be covered under your health and dental plan. And UFA has put some links. So if you're a graduate student, go to the GSA one. If you're an undergraduate student, go to the link for the MSU one, and you will get more information about what is covered under those. So again, you've got two different types of health plans. You've got your UHIP, and then you are going to have your supplementary plans. So UHIP is going to give you coverage outside of Ontario and within Canada. So it will give you equivalent coverage. So if you have a conference or you wanted to travel to another province of Ontario, it would give you equivalent coverage as UHIP within Ontario if you are outside of Ontario, but still within Canada. However, if you are traveling outside of Canada, if you have a conference that you need to go to or some field research or something like that that requires you to leave, or if you just want to go on a trip somewhere outside of Canada, UHIP has very, very minimal coverage. And it's probably not going to be sufficient coverage to cover your medical expenses. So if you are traveling outside of Canada, we strongly recommend that you purchase an additional private insurance to help you with that coverage if you are leaving Canada. So I do recognize, I think there were some questions here about bringing family members. So if you have a dependent who is coming with you, so that could be, a spouse or children, you are able to enroll them into the UHIP plan, but only once they have physically arrived in Ontario. So sometimes what happens is, you as a student, you might be arriving in September and then your family comes to join you in October. You would not be eligible to add them to UHIP until they are physically here. And so to add dependents, what you would need to do is send an email to our UHIP team, which is uhip@mcmaster.ca. And you'll need to include a copy of their passport page, their flight itinerary demonstrating proof that they have arrived in Ontario, as well as your student number. And now it is really important that you, if you do have dependents coming, that you do enroll them within 30 days of their arrival date. If you do not enroll them within that time, there will be a late charge, plus any retroactive enrollment fee. And so to enroll a dependent, there are fees associated with that. And if you go to uhip.ca, they should outline what those fees are going to be. And so we also did want to share that for some students, you might be exempt from UHIP. And so if you are part of any of these plans that are listed here on the screen, you would be eligible to be exempt from UHIP, because this means that the coverage that you see on the screen would be equivalent to UHIP coverage. And so if you are a part of any one of these, you can email UHIP at mcmaster.ca with proof that you do have this coverage in order to opt out of UHIP. Obviously, if you opt out, then you wouldn't be billed those fees. And this would be the same also if you, if you become a permanent resident at some point during your time studying in Canada, and you then have OHIP, the provincial insurance, you would no longer need to have UHIP insurance, and you could apply for an exemption.